My name is Dr. Scott Sweazy, board-certified practicing urologist, member of Carolina Urology Partners. Prostate cancer is the most common occurring malignancy in men in the United States. It's the #2 cause of cancer deaths in men in the United States. And it's very unfortunate in those deaths that these patients weren't diagnosed early enough, because virtually every case of prostate cancer, when diagnosed early enough, can be cured. As a physician, our first duty to the patient is to diagnose disease when present. When BK Ultrasound showed us the BK fusion system, I was amazed at the quality of the imaging that I could see. You have both the ultrasound imaging along with the MRI fusion biopsy system in that one unit. So it's an integrated system. The process of undergoing a multiparametric MRI fusion biopsy first starts with the patient getting a multiparametric MRI. At our center, we use a HIPAA-compliant, cloud-based downloading system to import the studies into our BK Fusion system. One of the nice things with the BK Fusion system is predictive fusion that already imports a contoured prostate MRI into the system. No longer do you have to calibrate two separate systems. No longer do you have to do a 3D sweep. No longer do you have to do a contouring of the prostate. It's integrated into the BK Fusion platform. When you sit down, you're ready to go. The workflow for a patient undergoing a BK Fusion biopsy is very similar to that of a patient undergoing the standard systematic biopsy. The prep is the same, patient positioning is the same, insertion of the probe is the same. Typically with the targeted biopsies, we obtain the systematic biopsies also. It adds minimal amount of time to the procedure itself. And then the targeted biopsies are obtained via manipulation of the probe as you're accustomed to doing. Every time you take a biopsy, that can be marked. So it can be stored on the prostate image in a three-dimensional format. So if you would like, at a later date, go back and review exactly where the biopsies were obtained, determine which ones were positive, and especially on a patient with active surveillance, determine whether or not this is an area that needs to be rebiopsied once again. Prior to using the BK Fusion system, we had a 39% positive biopsy rate utilizing systematic biopsies. With the BK Fusion system, that positive rate has now increased to 59%. So basically we have a 50% increase in the cancer detection rate of these individuals undergoing a biopsy. It's a better diagnostic modality that will then provide the patient with the answers that they truly need. And then we can have the discussion on how would be best to treat these patients.